Hey, manual therapy friends, it's Dr. David here, physical therapist from El Paso Manual Physical Therapy. I'm going to bring you today's Research Review Monday. It's out of the Journal of Manual and Manipulative Therapy. If you can't tell already, it's probably my favorite journal. Biased because I'm a manual therapist, of course. The title of this article is called Spinal Mobilization versus Conventional Physiotherapy in the Management of Chronic Low Back Pain Due to Spinal Disc Degeneration, a randomized controlled trial. This was done in Greece. You can see, it's not here, it's a little further down. Here we are, the Department of Biomechanics, University of Ioannina, Greece. All these places are in Greece, so I thought that was pretty cool that the Greek people are into manual therapy as well. So there was 75 subjects. They were split into 3 groups, 25 per group, and one group got manual therapy on the spine, so spinal manipulative therapy, mobilizations on their spine. The other group got a sham treatment that was designed to look like manual therapy, and then the third group got what they called conventional physiotherapy. So just to describe what each group did exactly, they did a good job putting in the article here what each group got. So in the green section here, you can see the manual therapy group got passive accessory intervertebral movements and passive physiological intervertebral movements, 5 sessions lasting 10 minutes each, 1 session per week. It did not say that they did any exercise. All they got was spinal manipulation or mobilization. So virtually like a chiropractic session is kind of like what they got, but they didn't do manipulation or adjustments as chiropractors say. They did the passive accessory movements, physiological intervertebral movements. So then let's go down a bit further. Here's the ST is the sham treatment group. The investigator held their hand in a static position, gently touching the skin. I'm going to have to go down here, overlying the lumbar spine for 10 minutes and did not make any other intervention. So all they did was put their hand on their back for 10 minutes and they didn't do anything else. And they did note here that subjects were unaware of their inclusion in this, so they didn't know that they were in a study basically. And then in the conventional physiotherapy group, they did exercise, static stretching of the hamstring muscles, of both sides for 5 minutes. So they did 5 sets, 1 minute each. So they stretched their hamstrings for 5 minutes each side. And then they did a TENS unit in the lower back. And it tells you here the 2 channels, biphasic pulse frequency, the pulse width, duration, all that stuff. And then they did a Swedish type massage, which included effleurage, petrissage, kneading, rhythmic pressures, and rolling in the lumbar spine for 15 minutes. So that's what they considered conventional physical therapy. So there you go. That's the 3 groups they had. Here's a chart just showing how they split them into 3 groups. Nobody dropped out. Everybody was included in the study. So they had 25 people go all the way through. Now, if you look at the results graph, check this out. Massive difference for manual therapy. Huge difference. Up to the 75% improvement here for these are the numeric pain rating scale, the Osteoarthritis Disability Index, and the Roland Morris Disability Questionnaire. So down in the sham treatment, they had virtually no improvement, and then in the conventional physiotherapy section, they had a small improvement, less than 25%, but over 50%, between 50 and 75% on the spinal manipulation or spinal, what they call it, passive intervertebral mobilization group. So I love this study. I thought it was great. I thought it was fantastic how they didn't even do exercise and they thought it was good. It's short term, definitely, and I'm a big fan of what we do as manual therapists is just short term. It's not going to last. It's if I just move somebody's joint, it's probably going to free up or stick again or get restricted or not move well again. Within days if they're not doing some sort of exercise or mobilization to self-mobilization, something on their own to keep up the gains that we make in manual therapy treatments. So manual therapy alone is not I think, a good long-term solution, and that this study didn't study that. They were just looking at differences between manual therapy versus hamstring stretching pretty much, and E-STIM and massage, and then just putting your hands on somebody's back. So I put this out there for you if you're doing either manual therapy type treatments where you're actually grabbing the vertebrae of the lumbar spine, you're doing some sort of lumbar gapping, some lumbar side bending, rotation, flexion, extension maneuver, then you're probably going to have a much greater impact on your patients than if you're not doing much for their spine. So are you in a type of practice where you're getting back pain patients and you're stretching out their hamstrings and doing E-STIM? I've seen that quite a lot throughout my years in practicing different areas, and obviously it is not near as a good of improvement as it is if you do some sort of a hands-on treatment to the patient's spine directly. So comments here if you have any questions or anything about this article, comments, things you wanted to point out. I'm happy to talk about it, and I hope to see you guys real soon. We'll see you on Thursday for the Manual Therapy Thursday. Bye-bye.